In Singapore, Singapore ranked very well, we think, as 18th. Taiwan did come in first in Asia, but Singapore has done quite a lot of work in the end-of-life care environment, where CPF here can be used for end-of-life care activities, both home care and institutional end-of-life care, support of charitable organizations like HCA, hospice, have really come up and are well known in the community. So Singapore again did very well. Some of the weaknesses that we see in Singapore is the availability of hospice and palliative care services on a per capita basis, relatively thin on the ground, and the existence of a government-led national palliative care strategy are two areas where work could be done. The strengths that we see in Singapore are the national pension scheme coverage. As I said, CPF and Medisave can be used there. The availability of volunteer workers, there are quite a number of volunteer workers in Singapore helping with hospice care. Average payment for end-of-life care services per week here rank very well as well. Also, the training for end-of-life care in medical schools is very positive here, and the accreditation of end-of-life care providers is something that that really helps Singapore in that section. And in the U.S., we felt it was important to cover the U.S. given kind of a lot of the heated discussion around the healthcare debate in the U.S. The U.S. ranked 9th overall, tied with Canada. Obviously, the outlier there is the cost of end-of-life care in the U.S. The weaknesses there are obviously the financial burden to patients on end-of-life care. As I said, it's over $10,000 a week on average for one to spend time in a hospice facility or in an institutional facility for end-of-life care. The relatively low percent of death touched by end-of-life care, as Dr. Goh said, there is almost a resignation that when one encounters hospice, that it is kind of surrendering to the terminal illness. In the U.S., for example, Medicare, with the Medicare coverage there, which is the social payment scheme for people over age 65, there is 6 months of coverage for end-of-life care in Medicare. You cannot go beyond that. After that, one has to maybe cash in their life insurance policy or somehow work private care or pay out of pocket. Also, Medicare only pays for curative care or palliative care. So this started in 1983 when Medicare started paying for these activities. One had to make a binary decision about whether they wanted to be treated or whether they wanted to have hospice or palliative care. It's the only country that actually forces people to make that binary decision. And there are places like the UK where one can have palliative care and curative care at the same time. And that really helps patients and their families through the process. Where the U.S. does very well is with the national pension scheme coverage. So with Medicare, everyone over age 65 does have access to those funds, although they have to make that trade-off decision. End-of-life care policy decision, accreditation of end-of-life care providers is very strong in the U.S., and the government attitude toward end-of-life care. Another strong area is the doctor-patient transparency, where doctors do actually speak to patients very openly about their options, about the state of their illness, and how their family can get involved in the process. So in summary, UK, Australia, New Zealand topped the index rankings. Again, this is largely a result of the quality of end-of-life care, again reflecting items like high public awareness of end-of-life care, training, and the long history in those countries, as well as the availability of end-of-life care on the ground in those countries. In Asia, Taiwan, Singapore, Hong Kong, and Japan ranked really in the middle overall. None of these countries has a government-led palliative care strategy, which is quite important. All but Japan have training for end-of-life care in medical schools. Awareness is pretty high in Japan and Taiwan, partly because of the age brackets and the voting blocks in those countries. Levels, I guess, awareness is moderate in Singapore and Hong Kong. Hong Kong and Taiwan have high levels of public funds available for hospice and palliative care. The Jinbao in Taiwan really covers palliative care for, in 2009, there was a new law that came in to cover palliative care for most terminal illnesses. Up until that point, it was only covered for cancer care. In Singapore, it's moderate, and there are lower levels of funding in Japan for end-of-life care. The emerging nations in Asia, say China and India, one relatively effective thing that could be done there is to raise the awareness of hospice and palliative care. We have a case study of the state of Kerala in India where end-of-life care has made great progress in recent years. That's covered in the report. And public funding for end-of-life care could be raised as well. With China's new national healthcare plan that was announced early this year or late last year, it's hoped that more funding could be placed on end-of-life care. So thank you very much.